hip or on that session?
Um,
Positions are
really the true cause and effect.
Yeah. So I was just thinking about the session better and worse. What makes your pain better and makes worse? Is there any positions or things that make you think more about lumbar or hip or on that session?
With lumbar, obviously, with what we're, and I'll go back to, because I'm sitting here as I go through, and typically these things pop up as you go along. The location of the complaint too, and this is a body diagram thing, so sorry for going back to that. Classically a hip complaint, if you're going to consider that, you would figure that you're going to have a groin thigh symptom, not a buttocks back symptom. That's just not classically what you'll see. So again, trying to differentiate out there. And again, these are things to put into your thought process. These are not definitive things, but the case builds as you go along, right? And so can a lumbar complaint cause groin pain? Yes. Does an SI joint cause groin pain? Can, right? So that kind of, but it does, if it's not in the groin, then I'm really not thinking a lot about the hip as much so. And I'm not thinking as much about the hip, especially if it's a unilateral, bilateral back, buttocks, and groin. So then you got to screen the lumbar out for that. Yeah. So going back to your question, worse, better. I think with lumbar, classically, and hopefully most folks that are listening to this, the curve reversal from sitting. Right? So they'll sit, flexion is provocative, it's obstructive, the rising is difficult. And so the first few steps are as they move, they feel better, right? And so a hip can be that way. And so identifying where they may feel that stiffness. So when you rise out of the chair and you take those first few steps, if they're not great, those two may sound a lot alike. So I rise, I feel stiff. My first few steps aren't great. And so as I move along, I feel better. So identifying, say, okay, when you rise, where do you feel the stiffness? Is it in your back or is it in your hip or groin area, right? So identifying that can help you at least get a suggestion towards, is it a lumbar or hip potentially? But again, I'll go back and state that, do you see growing hip pain that is lumbar, that does feel stiff at the hip when they rise? Yes, you do. So again, you have to differentiate top down, lumbar down, as to where your source is at. SI joint, when you look at that, I feel like that you may hear pain when you change or transition, but I don't feel like you're going to see as much obstruction or stiffness. So you may have pain during the motion, but maybe not as much obstruction. Again, I feel like that's a classic sound possibly for that. Now, some people may say, well, I saw a guy or a girl one time that did. It's like, okay, again, what's your vast majority going to look like? And then SI joint is a loaded, so when you load through that joint, just the same as the hip, I think as you make impact to that, and commonly, again, this is going with the most common things, a lumbar complaint, as you walk and you move further, especially your sagittal plane responders, they feel better. They're on the move, they're going, they feel best. I feel like peripheral joints, as you ask the peripheral joint to do more of what it's designed to do, that it will perform less and less well, right? So as that joint, if it's not a sound joint, then somewhere along the lines, it will start to become problematic again, right? So it may feel better in the in between, but there's a limit to that. So just some thoughts, from a peripheral joint perspective. And I know that SI joint classically in our manuals and things is in the other box, right? But again, if you look at it from how it looks on the body, there are two of them, and it's somewhat peripheral to the axial joint. So I don't know that it's not the first peripheral joint, if you think of it from that perspective. But it again, like the hip, I think as you ask it to do, or if you ask that shoulder to do more of what it's designed to do, I think it performs less and less well if it's the true source of the problem.
Yeah, no, that makes sense. A lot of good tips. And I was just thinking while you were talking, relating to my back pain one time. I had like hip pain for a long time and a lot of weaknesses on the thigh, inner thigh, and glutes and all of that. Going to doctors, that was prior being a PT and McKenzie, going to doctor, and then they saying that's like a glutes tendinitis or like something like that on the muscle. You when you go, you massage, you stretch, you do all of that, and of course it doesn't help. And then after, when I started doing 𝐏𝐚𝐥𝐤, I was the patient of another clinician. And then we found out my upper back, lower thoracic, the area there, once you put like you did